Hello, I'm Dr. Richard Fine.
My name is Dr. Michael Berry. I moved to the Memphis area in 2002, and then several years ago partnered with the West Clinic. And it is with that we've been able to bring Dr. Fine in, who has a national reputation. Our goal is to have a true breast center, not just an imaging center that images breast, but actually a center where you can walk in the front door and every aspect of your care, from diagnosis to treatment, can be performed under one roof. Why our center is a little unique, and what we're trying to do is to compress the time that it usually takes to get a mammogram, get a call back for an abnormality, and then a biopsy if necessary, which may take weeks, down to a day. So our goal is that a patient can come in, have her screening mammogram, and if she wants to, if there's an abnormality, it can be worked up. A workup mammogram is called a diagnostic mammogram, and it usually takes a little bit longer, and it may involve ultrasound. If that doesn't clear the abnormality seen, then a biopsy may be indicated. If a biopsy is done, our plan is to do it that very day and send the tissue off and have an answer within 24 to 48 hours. So therefore, we've taken what would normally take in 99% of the places across the country 3 weeks to get done, down into hopefully 3 hours. That gets rid of the anxiety aspect of it, the continuity of care we've discussed, and we're pretty excited about introducing that into this community.
From the standpoint of surgery, we're involved in multi-center national studies that have evaluated the treatment of the axilla. We used to remove 20 to 30 lymph nodes. Now we remove 2 or 3 lymph nodes with what is referred to as the sentinel lymph node biopsy. Now there are studies going on to see if the sentinel lymph node biopsy needs to be followed by the completion lymph node removal. And beyond that, we refer patients to the medical oncologists who have for a long time been involved in many studies to evaluate the treatment options, chemotherapy options for the patient. We actually will also participate in tissue banking studies, where we actually are taking an extra core of tissue at the time of the needle biopsy for the purpose of targeting therapy for the patient.
I think the benefit that we offer in that very point there is that we're working with the medical oncologist. So much of research and actually so much of breast care is fragmented. There's a surgeon that does the surgeon's thing, and there's a medical oncologist that does the medical oncologist thing. So the studies and trials were sort of limited to that. We've got the ability to cross over that the medical oncologist can come to us and say, hey, a component of our study requires a piece of tissue, like you described. We can provide that. So it's been nice to bring so many pieces of the puzzle together. I think we can broaden out how we take care of people in a more comprehensive fashion. The West Clinic in this community has earned the reputation as being the place to go for cancer care. No doubt about that. But I think a lot of women in this community do not see the West Clinic as a place to go for non-cancer care. We're providing breast screening. Don't have to have cancer for that. Even the biopsies we perform, 80% of them turn out not to be cancerous. So we want to change the image a little bit, that we're not just for cancer care, but we're for entire and total breast care.